Good afternoon, everyone. I'm Nirav Shah, the Director of Maine Center for Disease Control and Prevention. I'm delighted to be able to join everyone today to provide an update on where we stand with respect to COVID-19 and vaccination efforts for today, Monday, December 14th, 2020. And although we have some positive news to discuss in a moment, I must begin, unfortunately, with sad news. The Maine CDC has received reports of 2 additional Maine people who have passed away with COVID-19. One of whom was a man in his 80s from York County, and the other was a woman in her 80s, also from York County. Their deaths come on a day when we have just experienced another day yesterday with almost 1,400 new COVID-19 deaths and 184,000 new cases just yesterday alone. Over the past week, there has been an average of over 200,000 new cases of COVID-19 every single day, an increase of 30% from the average just 2 weeks ago. This news comes on a day when the United States as a country will likely surpass 300,000 individuals who have died with COVID-19 and over 16 million cases. To put that number in perspective, more Americans have died from COVID-19 in just the past 9 months than who died in combat over 4 years in World War II. The virus death toll, as I mentioned a moment ago, is likely to go above 300,000 people today, compared with about 291,000 American World War II battle deaths. Those numbers are staggering and serve as a reminder that although there is positive news to discuss today, which we will, let's not forget the storm, even as the sun is emerging. Right now in Maine, there are a total of 16,349 individuals who have been diagnosed with COVID-19, an increase of 426 new cases since yesterday alone. Of those, 14,339 are confirmed cases and 2,010 are probable cases. We've had 259 individuals who have died with COVID-19 in Maine, and cumulatively, 839 have been hospitalized at some point. Just in the past 30 days, 273 people have been hospitalized with COVID-19. And right now, this very moment, 198 people are in the hospital. Of those 198, 56 of them are in an ICU and 17 are on a ventilator. Presently across the state, there are 97 ICU beds available. Of our cases, 1,967 are among healthcare workers. Again, as I mentioned a moment ago, the number of new cases of COVID-19 in Maine, as well as across the country, has continued to increase in recent weeks. Just in the past 1 week in Maine, we have logged 2,574 new additional cases of COVID-19. We've sadly seen 32 more deaths and 28 people who are additionally in the hospital today as compared to 1 week ago, 28 more people. I'd like to take a moment to turn to some of the outbreaks that Maine CDC has opened just since the last time I spoke with you. I'll mention just a few of them. The first is at the Bonnie Eagle School, where we are aware of 8 cases, at Gorham Middle School, where we are aware of 3 cases, at the Old Orchard Beach High School, 3 cases, and at the Vassalboro Middle School, also 3 cases. Yesterday, on Sunday, we opened an outbreak investigation into the Stetson Memorial Church, where we are aware of 7 cases, and on Saturday, outbreak investigations into the Benton Elementary School with 3 cases and Ross Manor with 4 cases. Turning next to testing. Right now in Maine, the 7-day test positivity rate stands at 4.54% on a, again, 7-day PCR test basis, with a testing volume of approximately 600 PCR tests for every 100,000 people in Maine. Antigen testing, likewise, where the positivity rate now stands at about 5.25% for antigen tests being conducted in Maine. But the big item for discussion today is not testing or not the number of new cases. It is the arrival of the first doses of COVID-19 vaccine here in Maine. Today is a big day. The first 2 shipments of COVID-19 vaccine from Pfizer arrived in Maine this morning, one at Mercy Hospital and the other at Eastern Maine Medical Center in Bangor. Additional shipments are expected tomorrow at Central Maine Medical Center, at Maine Medical Center, at A.R. Gould, and at Maine General Medical Center here in Augusta. By any measure, today is a day to remember. The arrival of vaccine in Maine represents a significant positive development, a milestone in a process to begin planning for the arrival of vaccine that Maine CDC started undertaking back in April, a process that accelerated over the summer and then began focusing on the last mile in the fall, and then in the last recent few weeks, the final remaining inches. The arrival of this vaccine in Maine represents a light at the end of the tunnel. But even when you see the light at the end of the tunnel, it's important to remember that you're still in a tunnel and blue skies remain a ways away. Hard decisions have been made to get us here, and sadly, even harder ones are likely to be in the offing. Right now, in week 1 of our vaccination efforts, our focus is on hospital workers, those who have been providing daily, direct, close patient care to COVID-19 positive patients for months now. And this includes individuals, for example, who work in an intensive care unit, in the ER, or on COVID positive wings that have emerged in many hospitals, or for example, those who work as emergency medical responders in the community. From there, we will expand our vaccination efforts to more and more individuals across Maine, moving toward additional healthcare providers across the state. Collectively, this vaccine and the vaccination process that accompanies it will help us return to normal, something we all crave. However, it will take time for there to be sufficient supply to give every Maine person a vaccine. To put that in perspective, what arrived in Maine this morning was the first 1,950 doses of the roughly 2.6 million doses that will be needed to fully vaccinate every single person in Maine. Nevertheless, the arrival of this vaccine is the first of a number of significant steps. But in the same way that our spirits are lifted when we see the first buds on the trees begin thawing in the spring, we all know, even when we see that it will be many months ahead before the snow fully melts. That's where we are today. The process to vaccinate individuals across Maine is a massive undertaking, and there will be bumps in the road, as there would be with any undertaking of this size, scope, magnitude, and reach. Given that for many individuals who are watching, for many of you who have tuned in today, community level vaccine may be many months away, I'd like to talk a little bit about what you can do today to take control of your health. The first is, as we get ready for another set of winter holidays and concerns around another spike in cases similar to what we saw after Thanksgiving, the first thing you can do today is simply not to let your guard down. The arrival of the first doses of vaccine notwithstanding, COVID-19 has not been vanquished in Maine or across the country. Indeed, it's quite the opposite, given that we've had near record numbers of new cases in Maine just today. But the things that we have talked about for many months now remain just as important. Things like face coverings, things like avoiding gatherings, things like maintaining physical distance. Those are the things that Maine people have been doing in spades and have gotten us to the position that we are in now. Even though the vaccine has started to arrive, I ask everyone not to let their guard down. The second thing you can do today is to keep on top of your healthcare needs. Again, many of us won't be receiving a vaccine for many months, but we need to take care of ourselves today. You can do that by doing things like staying up to date with preventive healthcare, those screenings that you've been putting off, going in to visit your primary care physician, all of the things that many of us have put off during the pandemic need to be picked up today. If you're due for any of those things, be they screenings or preventive healthcare measures or a visit with your primary care provider, don't put them off a day longer. Another thing that you can do today is to go get your flu shot. I hear a lot that people say, well, wait a minute now, it's the middle of December. Flu season has already started. Haven't I missed my window to get my flu shot? The answer is no. You can get your flu shot at any time during flu season. And so if you have not yet gotten your flu shot and you have been worried that you have missed your window, that's not the case. You can still go get your flu shot today. And if you haven't done that, that's probably one of the best things that you can do today to protect you and everyone around you from the flu, which is still with us, even though COVID-19 may be what's top of mind, influenza is still out there. And the final thing that you can do today to take charge of your health is to check your open enrollment status, to check your health insurance status. Open enrollment ends tomorrow, December 15th. That is the final day to sign up for a healthcare plan through healthcare.gov. As Governor Mills said a couple of days ago, if 2020 has taught us anything, it's the importance of being prepared for the unexpected. Even if you're not sure what your healthcare needs will be in 2021, don't miss the opportunity to sign up for health insurance right now. If you are not sure what coverage you may qualify for, visit coverme.gov to learn more about affordable healthcare options through both Maine Care as well as through healthcare.gov. You can even pick up the phone and call Consumers for Affordable Healthcare Helpline at 1-800-965-7476. Again, open enrollment ends tomorrow. So that's just a snapshot of things that you can do today to make sure that you are in optimum health for whenever a COVID-19 vaccine arrives and your place in line is ready to go. So with that, I'm going to turn things over to our colleagues in the media, and I'm going to just pull up the list as we go to that. Everyone will give me just one moment while I switch over to that screen. Apologies for that, everyone. The first question for our colleagues in the media today goes to Emily Tadwalk at WABI.
Thanks, Dr. Shah. So my first question today is centered around vaccines. People are wondering what the vaccination process is going to be like for average Mainers when we get to that point. Will there be vaccine sites? Will you need a primary care provider? I'm sure you all have thought that far ahead, but have you planned that far ahead? And then I have one question after.
Sure. So the process for community level vaccines, which there may not be in sufficient quantities until the spring or into the early summer, That planning process is very much underway. But again, it is many, many months away for folks who, for example, are not healthcare providers or who may not be in one of the priority groups, i.e., they may not have significant health conditions. Our goal is to make vaccine at the community level as easy as possible to obtain. So we want to stress convenience more than anything else, or as much as anything else. That means geographic convenience, not having to drive too far, as well as just the convenience of the process, not needing to go through too many hoops in order to schedule a time to be vaccinated. In terms of where vaccines may be offered, we're looking at a number of different options. Some of them will be places that are familiar. For example, your local pharmacy, which, by the way, is a great place to get your flu shot. A place that folks are already aware of for that purpose. We are working with them to make sure they can offer COVID-19 vaccines. But we're also working with other types of vaccination sites. For example, we are exploring which of the existing swab and send sites that we currently have online may be quickly converted to start offering COVID vaccine, as well as, and eventually in lieu of, COVID testing. We're finally working with groups like EMS providers and other first responders like fire departments across the state to see whether they have the capacity and the infrastructure to offer vaccine as well. As you noted, Emily, none of those plans have been finalized, and the big variable out there is not so much our planning, but literally how much vaccine will be coming into the state. Once we know what that throughput looks like, we can have a better sense of how broadly to distribute it so that all of those options are available to Maine people.
And then the follow-up question is, how will people be informed when it's their turn to get the vaccine?
Sure. So it really does depend on which group you may be in. For example, phase 1B focuses on essential or frontline healthcare providers. For that, we may be working with their employers to notify employees that their place in line is ready to go. Group 1C or phase 1C focuses on older folks as well as those with significant healthcare conditions. That may be a system where we ask and work with healthcare providers to notify their patients. So it will depend greatly on the phase that we are in. It may be employers, it may be healthcare providers, it may be through general notifications like the discussion we're having today.
Thank you.
I'm going to turn now to Amy Brown at WERU.
Thank you, Dr. Shah. If the COVID vaccine provides an immune boost, is there any way that it might possibly be part of treatment? And in conjunction with that, if someone were to receive it who maybe didn't realize that they had COVID, they were asymptomatic, would that potentially help them recover from it?
So as to the former question, Amy, based on the scientific data that we have right now, it does not appear that the vaccine would be useful as a treatment, though that could very well change, as has so much of the understanding of vaccines and infectious diseases. That's part of the scientific process. But as of right now, it is not indicated for somebody who currently has COVID-19 or is recovering from COVID-19. At the same time, someone who may have COVID asymptomatically and receives the vaccine, it's not thought that the vaccine will harm them in any way. And indeed, it might help spur greater levels of immunity, but not so much in the form of treatment, but rather in the form of longer lasting immunity.
Okay, thank you. And a listener wrote in a question. They had sent a recent study by the American Society for Microbiology that found that the MMR vaccine might offer some protection from COVID. The lead author said, we found a statistically significant inverse correlation between mumps titer levels and COVID-19 severity in people under age 42 who've had MMR2 vaccines. And this adds to other associations that have demonstrated that the MMR vaccine may be protective against COVID-19, and it may explain why children have a much lower rate of COVID cases than adults, as well as a lower death rate. Are you familiar with those studies, and do you have any thoughts about that?
I am familiar with them. It's only one study. to be fair. And it's an interesting hypothesis. It's an intriguing hypothesis. The immune system may have cross-reactivity with the virus that causes mumps, but based on one study, it's too early to draw any firm conclusions.
Okay, just a quick follow-up. Regarding the outbreaks, can you just tell us the total number of new outbreaks since Friday?
Since Friday, we can tally that up and get that for you, Amy.
Okay, great. Thank you.
Sure. I'm going to turn it over to Joe Lawler next.
Yes, hi, thanks. Just a clarifying question first. So do we know for a fact that there was only those 2 shipments were received today, and that there will not be any more shipments today, the one at Mercy Hospital and the one at Northern Light EMMC? Is that correct, or will there be others later today?
Joe, I can't rule out that the logistics folks that are working on the shipping piece, the partners that we're working with, I can't rule out that they may have accelerated their timeline and that packages could arrive today. But as of right now, it's only those 2. Perhaps others will arrive, but what we've been briefed on is that the second set of shipments will arrive tomorrow. It's theoretically possible they could arrive today, but we're not really expecting them until tomorrow.
And so, and just to further clarify, so do you think the balance of the 12,675, the balance should arrive tomorrow? Is that right?
Oh, so Joe, what's arriving tomorrow is the vaccines that are not allocated for the long-term pharmacy piece. We'll get you the precise breakdown of the numbers, but what's arriving tomorrow, or today and tomorrow, is the first 6 shipments of Pfizer vaccine that are not part of the long-term care pharmacy program. That was a separate allocation that states were required to make if they elected to participate in that program, which Maine absolutely wanted to participate in. So what's arriving tomorrow will be roughly approximately 4,000 doses of, well, under 4,000, about 3,900 or so doses.
Okay, and then just finally, so like, we're seeing images and videos in other states of people actually receiving the vaccines today. Do you know why in Maine people aren't actually getting the vaccines today? I think they're going to get them on Wednesday, maybe.
I would refer you to the healthcare providers that are doing that frontline vaccination. We understand that at least as of Wednesday morning at 6:30 a.m., the first clinics will be going online within Eastern Maine Medical Center in the Northern Light system. But I would refer you to them as to what their timeline is for rolling it out.
Thank you.
Mm-hmm. I will turn now to Jackie Mundry at News Center.
Hi, Dr. Shah, thank you. As far as the order of people getting vaccinated, obviously the frontline workers are first, the people that are most in contact with COVID-19 positive, but what about, dentists or physical therapists or other frontline workers? When will they be vaccinated?
Sure, well, they are considered to be healthcare providers, as are a number of others, outpatient clinicians, those who work in various outpatient settings. All of those are considered to be healthcare providers, and we consider them to be part of phase 1A. They may not be at the same exposure risk, for example, as an ICU nurse or an ER nurse, but they are considered to be part of 1A. So it will be a little bit later on in the process, maybe in subsequent weeks. Right now, our focus on weeks 1 and weeks 2 are the front of the frontline healthcare providers, such as ICU nurses, healthcare workers who work on COVID units, as well as EMS clinicians.
And then I have an unrelated question, more related to testing. How is the rapid test positive being counted? Is that going to be a probable case in the numbers? And then the PCR test is the confirmed cases?
That is correct. It's noted on our website. Maine CDC follows the case definition that is put forth by the group of professional state public health epidemiologists and the US CDC. An antigen positive test is considered a probable case unless it is later confirmed by a PCR test, which many are. And then, of course, a PCR test is considered a confirmed case.
Thank you.
Mm-hmm. I'm going to turn now to Evan Popp.
Hi, Dr. Shah. Thank you. I was wondering if you could provide an update on the outbreak at the Lewiston Police Department. First, if you have any latest numbers from that, and second, I was sort of wondering if you had a update on the outbreak investigation, if Maine CDC has determined if appropriate safety protocols such as wearing a mask were being taken by officers prior to the outbreak.
Sure. So Evan, the latest numbers that I have show 16 cases, but I want to emphasize that that number may not have been updated this morning. So if Lewiston PD probably has a more accurate and up-to-date number than what I've got at my fingertips right now. In terms of the investigation, I know that it is underway. I haven't heard any definitive findings about the potential cause, nor have I heard any findings about, for example, mask wearing. We can check and get back to you, but I haven't been briefed out on any findings or conclusions from that investigation.
Thank you.
I'm going to turn now to Ashley at WAGM.
Hi, Dr. Shah. The county is showing 2 deaths on the Maine CDC website. We know of 2 additional ones. So I'm wondering, what kind of investigation does CDC do to attribute a death to COVID, and how long does it take to show in the database?
Sure. It can take several days, if not weeks, because what has to happen for a death to show up in our database is, among other things, it has to be reported over to us. It can take providers a number of days to report a death to us. After a death is reported to us, and that's understandable because providers are very, very busy. And so that is no fault on the provider. It can just take a number of days for them, if in some cases over a week or 2, for deaths to be reported to Maine CDC. After the death is reported to Maine CDC, we determine whether the individual died during their period of COVID positivity or whether the death sadly occurred after that. That's the algorithm that we use to determine whether someone died with COVID and thus is counted among our deaths, or whether if they died after their recovery period, whether it's not counted. I'm going to turn now to Steve at WMTW.
Thank you, Doctor. I'm sure this is probably under the planning stage, but there are a lot of people, especially in long-term care facilities, who will not be able to travel to get their vaccines. Will there be plans to go to them?
Steve, there are very, very intricate and detailed plans that Maine CDC has been working on in partnership with the US CDC, as well as with commercial pharmacies, to bring vaccine to the staff and the residents of long-term care facilities. Long-term care facility residents and staff are considered squarely as part of phase 1A, given the disproportionate share of cases and sadly deaths that have occurred in those facilities. Many months ago, many months ago, we began a planning process with those parties, with the long-term care facilities themselves, with commercial pharmacies, with the US CDC and Operation Warp Speed, to ensure that vaccine would be brought to those locations in a series of on-site clinics. Steve, a moment ago, I mentioned in connection to Joe Lawler's question that there were a certain number of doses that would be set aside or reserved or allocated. That's what I was referring to here. Now, those doses are not yet in Maine. They are in a warehouse somewhere, theoretically, maybe not even physically, but on a spreadsheet somewhere as being earmarked for this program. We activated this program 2 Fridays ago, and that set off a series of planning steps that take about 2 weeks, scheduling those visits to the long-term care facilities, obtaining proper informed consent, determining the number of individuals, splitting up the doses so that they show up with just the right number. That process takes about 2 weeks. We understand that the first such clinics could begin as early as next week. I don't have confirmation that they will begin, but that is an entirely separate but important parallel process that's going on in concert with our efforts to vaccinate frontline healthcare providers. A very important process. I'm glad you raised it. It's not something we've talked about too much up until now, but very, very critical process. I'm going to turn now to Patty White.
Thank you, Dr. Shah. I just wanted to follow up on that, the long-term care dose questions. So when are those doses expected to arrive, even though the clinics may not be till next week? When are we supposed to get them?
Those doses will actually not be coming into the possession of Maine CDC. They will actually be going to commercial pharmacies themselves and then be allocated from there specific to the various to the long-term care facilities themselves. So what we've been briefed on is that the pharmacy chains will have staging areas, and that the employees who will be tapped to go to long-term care facilities with appropriate PPE to provide vaccines will be obtaining the vaccine from those staging areas, not necessarily through the cash that's delivered, say, to our warehouse or to hospitals.
Okay, thanks. And can you tell us, even though we're in this pandemic for the long haul, even though, vaccines are starting now, what do you hope and expect will be the first significant change once healthcare workers and people in nursing homes are vaccinated? Is it fewer deaths or something else?
That would be wonderful. Certainly, Patty. What I think will happen, and this is dangerous speculation, but it is informed by some of the epidemiology that we've seen with other infectious diseases. The hope is that by focusing on, say, frontline healthcare providers, as well as nursing home, long-term care facility staff and residents, that outbreaks in those facilities can be held to a minimum. They will unfortunately still happen, and that's a difficult reality. But even with a highly effective vaccine and high vaccine coverage rates, there may still be outbreaks. But our hope is that the number and the magnitude of those outbreaks is lower. It also means that hospitals, particularly healthcare workers, may not face the same, say, for example, staffing crunches. Right now, a number of facilities, hospitals and long-term care alike, are facing difficulties maintaining proper staffing or optimum staffing because so many of their staff have, say, been exposed to COVID and thus need to be out in quarantine. So what we think it will do in the immediate term, by immediate, I mean the next couple of months, not couple of days, just to be clear, but over the next couple of months, we'll be able to fortify the staffing within healthcare facilities, as well as to reduce the number of cases and hopefully the number of outbreaks, but recognizing they will still happen. We at the Maine CDC will have to keep our epidemiological vigilance at the same level because those cases and those outbreaks will still happen, but hopefully in lower numbers.
Thank you.
I'm going to turn to Joe at WGME.
Good afternoon, Dr. Shah. While we wait for widespread availability of vaccine, my question is about contact tracing. 18 states are now using COVID-19 exposure notifications, and Apple and Android platforms they rolled out several months ago. And with the increasing number of cases in Maine and the strain that you've talked about on your contact tracers, are there any plans for you to sign off on that in Maine? And if not, why not?
It's under discussion, Joe. We have definitely not ruled it out. Talked about this last week a bit as well. The question for us, Joe, whether this is one of our top priorities or a priority that we should work toward. The reason I say that is that it is true that a number of states have rolled that system out. But I've also seen reports in the media, as well as in talking with my counterparts in those states, that the uptake of that system has not been so robust. Bear in mind that this system is one that requires the person with COVID-19 to opt into. It is not an involuntary thing. We can't forcibly require that someone's cell phone go back and ping everybody that they were in contact with. The individual who has tested positive has to receive a specific code from the state health department, which enables them to turn that system on. And in many states that have rolled these out, I referenced North Dakota last week in a question, I think in connection with a question from Evan Pop. In North Dakota, for example, even though they undertook the IT architecture to turn it on, they had fewer than 50 people who had actually said, I want to be part of that. I want to tell my close contacts. And those people at the time only generated 91 notifications. And that was as of about a week and a half ago. So it's not that we've ruled it out whatsoever, Joe, not whatsoever. The question is, given everything going on, whether it's our top priority or a priority that we're working at, but maybe that we need to focus on other things right now. That's the honest answer. I like the idea. As someone who is interested in technology and enjoys technology, I think it's a good thing, and I applaud the partnership from Apple and Google. It's just a question right now of, given the rather significant IT infrastructure changes that need to be made, whether it would make a difference if folks aren't using it. And that's what I've heard from my counterparts in other states. And the final question for the afternoon goes to Caitlin Andrews at the BDN.
Good afternoon, Dr. Shah. With hospitalizations where they are right now, has there been any discussion about possibly standing up any of the remote sites, or if not, what is kind of the threshold you guys are considering for that?
Yep. Caitlin, the discussion there is, the discussions there continue apace. Right now, for example, there are 94 ICU beds that are available across the state. And by available, I do mean free as well as staffed. And so those discussions around alternative care site planning are continuing because we want to be ready if we get to that point. In the immediate term, we don't see that happening. But again, as has happened in other states, you can go from the immediate term and not see a need for it, to all of a sudden see a need for it in a matter of days, if not within a week. So we're continuing with that. I think even though there is not a particular threshold, again, there's not a switch on the wall that we flip. What I think would be the marker that would tell us to move even further into the planning process is if we project that the number of ICU beds would become in jeopardy. Again, there's not a hard number there. Some of it depends on the velocity of the increase, the acceleration. So hypothetically speaking, purely hypothetically, if we went from 94 available and staffed beds in week 1 to the next week only having half that, even though that still means that there will be 40 plus beds, that rapid expansion of critical care patients would be a definite sign. So those are the signs that we're looking for and in order to move forward with the next stages of planning, which would be the setting up of the system. I don't see us being there right now, but I want everyone to know there are very frequent meetings where we are discussing and assessing the situation so that if we get there, we'll be ready to move in that direction.
Thank you.
Thanks, Caitlin. Well, everyone, thank you all for taking a little bit of time this afternoon for joining. It is a significant day in Maine, a day that I think will be remembered, but it is just the first of many such significant days. Again, overall, across the state, we will need roughly 2.6 million doses of vaccine to have every single Maine person fully vaccinated. What we've gotten today is the first roughly 2,000 of those 2.6 million. So there are many steps ahead of us. And as we talked about today, it may be several months from now before community level vaccine is available for everyone across the state. But until we get to that time, I ask everyone not to let their guard down. Maine has made tremendous strides in getting to where we are right now. You don't need to spend more than a few minutes watching TV to have them throw up one of those maps of the country to see that while many places in the state are having to, in the country rather, are having to find new colors to denote how bad their situations are, Maine, even though our situation is bad, is not in the same league as what has occurred in other states. But sadly, and I hate to be grim, what's happened in other states could happen here. We could experience the same devastating outbreaks that, say, the Great Plains states, the upper Midwest have experienced. So we need to do everything in our power today to keep ourselves shored up and safe, and we can do that by keeping our guard up. What you can do right now is, first of all, keep doing the things that you've been doing, wearing a face covering, staying physically distant. Another thing you can do is to check in with your primary care provider. Many of us, myself included, have been putting off those visits, and I'm trying to take deliberate steps to reconnect with my primary care provider, with my dentist, with so many folks that I've put off for a long time. The third thing you can do today is to go get your flu shot. It is not too late whatsoever to go get your flu shot. And the last thing you can do is to prepare for 2021, especially your healthcare needs. Open enrollment ends tomorrow. You can visit Cover Me or healthcare.gov to see what options are available to you. Those are concrete, proactive things that everyone can start doing today while we all eagerly await subsequent deliveries of COVID-19 vaccine. I pledge to keep you posted and up to date as to where we stand with vaccine efforts as they change, which I'm sure they will. But in the meantime, thank you all for your time today. We will talk again on Wednesday. And in the meantime, please be kind and take care of one another. Talk to everyone soon.